common cause of hip pain is psoas tendonitis. The psoas tendon is the muscle that runs in front of your hip. It goes directly over your hip joint and shares the same nerves as the hip joint itself, which is often why it is confused for hip arthritis. This is pain that you're probably going to experience most when getting up out of a chair, going upstairs, or climbing into a vehicle. The pain will be in the front. In order to improve this pain, besides the modalities that have been discussed with you in clinic, our stretching exercises focused on that. Having a table or a desk or a countertop that you can help brace yourself with, stabilized to ensure no falling. You will take it to your right foot. So if your left hip is the affected hip, your right leg would be in front of you and your left leg would be behind you with both legs pointed forward. You'll take your back knee and slightly bend it down. You can increase the amount of stretch by how far you bend your knee and also by how much you extend your pelvis leaning backwards. That will create a stretch within the growing region. You only want to stretch, not pain. You will hold this for 5 seconds for a set of 10, twice a day. In a week's time after having done this stretch, you can increase it by dropping your knee more or by extending your pelvis more. Another important stretch for the hip flexor complex that will assist you in improving overall will be with your back leg turned 90 degrees or 60 degrees, one of the two, whatever is more comfortable for you. And then, same exercise, leaning forward, dropping down your pelvis, leaning backwards at the pelvis or hip as well. The reason for this is that this will stretch the hip adductor complex, which is often associated with the pain described within the groin for hip flexor pain. This, along with the other modalities discussed in clinic, will improve your overall clinical symptoms over a course of time.